Before we talk about housing, I'm curious to talk about those that would love to see housing, those that have maybe never seen housing. Then Mayor Stephen Mandel introduced several years ago an ambitious 10-year plan to eradicate homelessness in Edmonton. I know it's hit a few bumps in the road. Where are we today?
Well, someone just tweeted me this morning, and I get this story sent to me all the time, which is Medicine Hat ended homelessness. Why aren't we doing the same thing? And I'm thrilled for Medicine Hat, but we've been doing exactly the same thing. It's a very basic model called Housing First. You put roofs over people's heads, and then you bring the services around them to help them deal with their addictions, to get career counseling, the supports that they need to reintegrate and be successful in society, draw less on the healthcare system, draw less on the justice system, contribute less to social disorder. And the business case is amazingly good, which is why people across political spectrums have adopted this Housing First model across this continent. And we've been extraordinarily successful with it in Edmonton because we've housed over 4,000 people, many more people than they housed in Medicine Hat. But the challenge is 3,000 more people became homeless. This is why we have this focus on ending poverty, because that's the major contributing factor to becoming homeless. And but the other barrier to getting to the finish line on the 10-year plan to end homeless, we still have over 2,000 people who are homeless in our city. The last time we counted, is the need to develop more units specifically tailored for the quote-unquote hard to house people with very complex addictions and mental health issues. And the challenge is no one wants that housing in their neighborhood. And that's an unfounded fear in a lot of cases, but I understand where the fear comes from. But that's moot if the funding isn't there to build the units. And this is where we need active partnership from provincial and federal governments to build the much needed units so that we can house the last 2,000 people, including the really hard to house folks, and do the prevention work to prevent people from falling into homelessness in the first place.
So in other words,
you can do what Medicine Hat did. It's just that when you're the big city and Medicine Hat's hardest to house people don't stay in Medicine Hat, they come to downtown Edmonton. We need some extra help in order to get to the finish line. But
is it almost naive then for a city to have a plan to eradicate homelessness without trying to bring in the province and the country?
Well, it's actually a really good example of alignment among governments, especially with the provincial government. But you saw a lot of Alberta cities adopt 10-year plans to end homelessness, and we saw the province adopt a 10-year plan to end homelessness. Now, frankly, I think the provincial commitment wandered for a while there, particularly around building these units, because it is expensive to build these units, and it's expensive to run these supportive housing complexes, but it's still way cheaper than jails. It's still way cheaper than emergency room visits, and so there is a return on investment, and we're working very hard with the new government to articulate that and help them defend the needed investment in these kinds of units in our city. So, and the federal government has been committed and increased funding to Housing First. Unfortunately, at the same time, they've decreased funding to the tranche of money that supports the maintenance of existing social housing units, to say nothing of the need to construct more. So we see the federal government supporting the Housing First model right now, but not, unfortunately, supporting the construction of these much-needed units. And we've actually seen, because of declining federal funding, the closure of 80 such units in our city in this last year, which is absolutely the wrong direction if we're going to get to that goal of ending homelessness.